Hello. Short discussion. We're discussing mental health and sexuality, and I wanted to run this by you just quickly. There's only a couple things mentioned here, and I'll wrap it up with a point I'm trying to make. So, where we go. This is a discussion of mental health and sexuality, and these two major mental health issues that you're intimately aware of. Let's start with sex and depression. How are they connected? MDD, major depressive disorder, causes a host of issues, sexual issues in our case. Impotence, ED, of course, in men, sexual pain, loss of desire in women. Actually, depression just puts a damper on desire. You don't even want to participate in that sort of thing with your partner. As you well know, depression takes away pleasure. It takes away that emotion of pleasure in things that in the past for you were pleasurable. And this is one of those things. So people, particularly living with depression during a dating stage in their life. Now, don't start thinking teenager because, hey, people get divorced and they start dating again. And maybe they're old folk. I know old people my age that, believe it or not, still date when they can remember what dating means. So, in the dating stage of your life, whatever it may be, and you have depression, then it could be that you feel less interested in putting yourself out there. I'm not interested in social connections, for example. I don't create opportunities for intimacy or social connections. And it just perpetuates the depression. I'm depressed because I'm not going out with people. I'm not going out with people that depresses me. So it's almost like a vicious circle, to coin an old term. Women are more likely to experience symptoms of depression, and believe it or not, and that causes them in some cases to feel insecure about their body, feel less desirable, doubt their sexual confidence, and they feel insecure about participating in those kind of activities. So it's an ugly little thing, this depression deal. The reason I brought this up is because I'm not too sure that you or a lot of people could make that connection. You pay a price. There's an emotional toll that you pay in negative thinking and low self-esteem. And because of that, and you know this as one of the symptoms of depression, people tend to give up on day-to-day things, including self-care. So you could actually, because of the depression, losing out on the activities that you feel are important, and again, you know this, I'm sure, is that down the road there are consequences. You're going to begin to have physical issues, all based on the fact you're not taking care of yourself. What does taking care of yourself mean? Eating properly, exercise, proper amount of sleep, etc., things that we take for granted unless we suffer from MDD, clinical depression. And then when you apply that to sexual things, women who are depressed and who are experiencing loss of desire for sexual activity have low libido, that's sex drive, just in case you've forgotten, low arousal, and if you're on an antidepressant for the depression, it can worsen the dysfunction. So women, and this is applicable only to women according to the study, women may experience no interest at all in sexual activities. This applies to married couples and unmarried couples. So that's the depression side of it in a nutshell. There's a lot more to it. If you're interested enough, you can go to the Journal of American JAMA. My brain just took a hike, and look in the section about psychiatry. And there's a long discussion about what we're talking about right now. And how about PTSD? there's been a great lack of recognition of females with PTSD. Go figure. It was associated initially with male combat veterans, and then it was called shell shock, war nerves, a lot of terminology. And now, of course, it's known as PTSD. It's known as PTS. At one time, was known as PTSS, post-traumatic. It was a syndrome, post-traumatic stress syndrome. Then it became a disorder. Now it's reclassified. It's taken out of the anxiety realm, put into a stress-related trauma. So whatever you want to call it, we all know what it is. In this case, we're not talking about veterans per se. We're talking about traumatic experiences that anyone can have. By the way, just as a sidelight here came to my mind while I was reading this before, a lot of people don't understand that you can suffer PTSD and not ever be a participant in something. You can witness something that's traumatic for you as a witness, and you can develop PTSD. A lot of people don't know that. They think, oh, I have to be directly connected, and that's not the case. You do not have to be. You can just be an innocent bystander. So with all that in mind, we're not talking about that. We're talking about direct involvement. And here with PTSD here, we're talking about how it affects you sexually, meaning in our case, for the point of discussion, something that has happened in a person's past that they were a victim of. And in this case, traumatic experiences in childhood, sometimes that are connected to sexual things. So you have the experience, you suffer the psychological consequences, and then these become long-lasting if they're not treated. So the long-lasting psychological consequences of an event that happened in your childhood. And these things show up sometimes immediately, not always. There are very few studies, as I mentioned. There's very little information related to PTSD and sexual activities. Don't ask me why, I don't know. But the ones that have been out there are very good ones, and they show a correlation between having a history of physical, emotional, and sexual abuse among both genders, men and women. And the idea is that sex can be a triggering experience because of these past traumas. So put two and two together. If you've been sexually abused, then you are constantly reenacting the trauma when you have relations with your partner. And women particularly are more likely to experience sexual violence and then consequently develop PTSD. Not as much in men. And look at these other things. While we're on that, domestic violence, role conflicts, gender discrimination, sexual harassment. My goodness gracious. There's a whole list of things. All impacts their mental health. So what's the end result of this? Feeling of inferiority, feeling isolated, anxiety, depression. All these have an impact on the dysfunction that has developed. So there you go, short little wrap up. This is not the only two items that can cause this. Any OCD, bipolar, anything that's serious in the universe of mental health disturbances obviously can have an effect on everything, including sexuality. So there you have it, a little old shorty. All righty, talk to you soon.